on. So I will start. This is calling to order the meeting of the Information Needs and Data Exchange Committee, the Index Subcommittee of the Incarceration and Prevention and Reduction Task Force on June 5th at 2:30. Before we start, I would like to acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. So welcome, everybody. We have a fairly full agenda today, so I would like to go ahead and start right off. Julia Garrett, who you remember from our past meetings, is our Village Reach consultant, and we have asked her to present her close to final report. She is here through the end of June, and she may have more information to tell us about that. So the initial part of the agenda is to hear what she has to say, and then listen, please, with an intent to discuss what the next steps are for our committee. If and when she wraps up her work, we then have to decide how we proceed forward. So go ahead, Julia. We look forward to hearing what you have to say.
Thank you, Birdie. And I will just clarify that things are still in draft form. So take that into consideration with what I'm working towards a final version, though. So I will go ahead and share my screen. And I need to send requests to do that. Okay. And I have dual monitors here, so if it looks like I'm not looking at you all, that is why. And just to confirm, you're seeing my yep, awesome. Okay.
Change.
So for some of you, this might be something that you have already seen, depending on what meetings you have or have not been in attendance for. And this is, a draft of the measures that I am suggesting. Sorry, I'm trying to see if I can zoom in for you all. Okay, that's a little better. And so, yeah, so I wanted to quickly go over that today, and then spend some time on the kind of data systems piece, especially given that this is the index committee and who we have on the call. So, if there is anything that I go through kind of quickly when it comes to the measures and you want to go back to, please just let me know. But I'm not going to go through every single one because that would take potentially longer than we have here today. So, this is a very high level attempt to get everything all in one kind of visual of the Justice Project. And as you all know, it's very complex and so and multifaceted with 5 strategies, 15 projects, and then all of those aiming to reach definitions of success at the systems, services, and facilities, and then creating these high-level outcomes of reducing jail bookings, shortening average length of stay, increasing connections to care upon jail release, and lowering recidivism rates. all with the greater goal of achieving increased health and increased safety in Whatcom County. And so a lot of this is how it's set up is based around the results-based accountability framework. And what you'll see is, we're aiming to answer these 3 key questions, which are how much did we do, how well did we do it, and is anyone better off? And that can span the results-based accountability framework, spans both population accountability as well as performance accountability. And so performance or program accountability is those 3 questions I just mentioned. And then population accountability is looking at whether, for example, the Justice Project impact can be felt at the population level, which is that increased health and safety, as I was mentioning. And there are kind of 3 main levels of evaluation that I'm proposing, and they map to the RBA framework above. So this process evaluation, which is getting at performance accountability, is really exploring the what did we do and how well did we do it. And then an outcome evaluation is still also looking at that performance accountability level, exploring that is anyone better off question, and focused on outcomes for those who are involved in the behavioral health and criminal justice systems in Whatcom County. And then finally, the population accountability, which aligns more closely with, what we would call an impact evaluation. And that's looking at if there's any detectable population level change. So in this case, that's referring to population of Whatcom County as a whole, not just those who are involved in the behavioral health and criminal justice systems. So what I've done is put together some tables that list the measures that I'm suggesting to answer the what did we do, how much did we do, how well did we do it, and is anyone better off? And looking at those from process, outcome, and impact evaluation. And this kind of gets added a bit more, small font, so apologies. But yeah, the process evaluation is looking at those 15 projects. The outcome evaluation is looking at what's in this green box here. So definitions of success at system, services, and facility levels, as well as the higher level outcomes. And then impact evaluation is that increased health and safety I mentioned. And so, yes, so I'm not going to spend time really looking with you all at the process evaluation measures, because those are very specific to kind of each of the 15 projects, and map to a lot of, what we're already reporting out on for those executive reports and whatnot. And so let me go to and these will get, filled out further. That's what I said. This is not a final version. So moving up to the outcome evaluation and looking at that question of is anyone better off? We have tables here at the system level and looking at ways that we can, try and measure questions such as, have system gaps been strategically addressed and intended outcomes been achieved through policy changes? Are people assured speedy and fair resolution of legal issues to reduce unnecessarily long jail stays? So it's these questions that are getting at, are we being successful in this case at the system level? And then, identifying indicators that could be used to measure those. And, in full transparency, there's not always going to be a perfect indicator to measure some of these really big picture questions that, are very multifaceted. And so in some or many cases, they're proxies that at least try and get at being able to answer that. So we have, for example, if we're looking at assured speedy and fair resolution of legal issues to reduce unnecessarily long jail stays. So looking at measuring the reduction in median pretrial detention length, as well as, the percent of cases resolved within established timelines, things such as that. And like I said, I'm going to go through this quickly so that we can kind of get into the discussion element, but we can go back as we're discussing if there's things that you all are hoping to talk about in more detail. So just as we have for the systems level, we have for the services level and facility level as well. And these evaluation questions are stemming from the definitions of success that that came somewhat from the needs assessment, as well as then in discussion with the JPOP, and kind of updating those goals to map to any kind of changes or things that needed to be updated based on how things have been going over the past few years since the needs assessment was done. Yeah, so similarly, services level, we have questions to try and get at if we've reached success, or our definition of success at the services level, and then also at the facility level. And then beyond that, we have the key outcomes, which are those 4 high-level outcome measures that are getting at the population that is involved with the behavioral health and criminal justice system. And that's looking at, number of jail bookings, average length of stay, connections to care upon jail release, and recidivism rate. Let me pause there before getting into the data kind of sources and landscape, and see if there are any kind of immediate questions or things people want to discuss or look at in more detail.
I just want to ask if there is anyone who would have liked to give feedback to Julia who hasn't had the opportunity to, because we ran into issues of offline quorums with committees and not doing it in a public way. So this meeting is an opportunity, if any of you have specific feedback, to say it publicly at this point. Some of you may have already had ample opportunity, but I want to make sure that everyone on this call does. Not hearing any other. So carry on, Julia.
Great. And then there's the impact evaluation, which is getting at those much larger questions of, did health improve in Whatcom County, and did safety improve in Whatcom County? And this, I think an impact evaluation comes with the caveat that when we're talking about questions that are this big and broad, that, can be impacted by many different things, not just what's happening within the Justice Project. This is not, answering these questions and tracking these indicators is not something that we could sit here and attribute solely to the Justice Project if we were to see changes. And so these are some indicators that could be used, once again, kind of as proxies for health and safety. And yeah, so any comments or questions kind of on what I just shared regarding impact evaluation, and or, we can take, a pause for a minute or two for people to read through these ones, and let me know if you have any that you feel are missing or need to be changed. Okay, I'm going to take silence as we can move on to this piece, which I'm guessing there might be a lot more, conversation around. So I want to preface this by saying, I've gone through a lot of different documents that are out there, conversations that I think over the past few years have been put together and attempted to map the data systems to the sequential intercept model to try and understand the flow from intercept 0 through intercept 5. And I'm going to take a guess that I didn't get everything right. So I would like to hear from people if you're like, nope, that is not correct, or you're missing this, or this also actually pertains to a different intercept. And I find it's easier to react to something than coming up with it out of nowhere. And so that's my hope today, is that we can have a discussion and go through what I've put together here today and make live edits and changes, comments as needed. So what I tried to color code this in a pretty straightforward way. And this is something that I think Jeremy can let me know if I captured this wording here correctly, but in green, I'm indicating, it's something that can be accessed and pulled into WCHCS's data warehouse, if that's the correct term. If not, let me know. Versus anything that's this reddish pink cannot currently be accessed and pulled into the warehouse. And then some that I had questions about that needed further clarification that I wasn't sure on.
Mm-hmm.
So it is, there are, as I'm sure you are not surprised, there are many rows here, but, I kind of would love to go row by row and confirm that this is accurate, and if not, how it needs to be changed.
CAD and Whatcom 911 are effectively the same thing.
They're effectively the same thing. Okay.
I mean, don't say that to dispatch, but for our purposes.
Sorry, 1 second. If not, oh, because I zoomed in. I need to enable comments. Okay. Okay. I will combine these for our purposes. And do folks agree that, kind of when we're thinking about the sequential intercept model, that CAD, Whatcom 911 are, in terms of data, really pertaining to intercept 0 around community services and intercept 1 around law enforcement? I will take silence as agreement, but please.
Right, since we can't see everybody,
Yeah.
anyone has an objection, please raise your hand or speak up so that Julia can get that feedback, because it makes it hard in this format.
Mm-hmm. And then for fire EMS data, I believe that's in image trend and also is at intercept 0 and intercept 1 of the SIM, and then is, from my understanding, something that can be accessed and pulled into WCHCS data warehouse.
Correct.
Epic, so St. Joseph's Hospital and the emergency department. I wasn't sure on if this is something that can be accessed. And then also, once again, same question of, is it just at 0?
Hospital's a black hole. The only conceivable alternative is to go through the DOH and apply for a exemption from, we'd have to alter a data sharing agreement. That information exists, that information is accessible. There's a significant administrative project it would take in order to get it.
Okay.
For some background, there's been attempts to engage the hospital from EMS and other programs with extremely limited success over the course of most of the last decade.
Okay. And, when we're looking at the data here that would be in Epic, if we're not able to access it, what is the biggest hole that people feel like, right? We have other data sources that are accessible at these first 2 intercepts. So what is the hole that not having access to this?
The population that we do have information about tells us that folks that are not stable economically or medically utilize emergency services at a rate that is vastly disproportionate compared to the rest of the population. And Caleb can speak to this in great detail, where it is not uncommon for individuals to hit the jail and the ER and the EMS and interact with police again and head back to the jail. And so it is one of the 3 main stool legs of the emergency response system.
And it impacts the subgroups that we want, behavioral health and substance abuse disorder, obviously, because a lot of people present to St. Joe's Emergency Department with as their initial contact, and that's data that we would want.
It's the only place you're going to find true medical determinations. Other programs and systems aren't necessarily equipped to do that. EMS is medical in nature, but in making like, ICD-10 diagnostic code, their scope of intervention is pretty limited. It's not a bug, it's a feature. They're not there to diagnose mental health issues.
So if what I'm hearing is correct, we can't currently access it, not because like the information exists and could be
Right.
accessible, but it would be a significant administrative hurdle via updated data sharing agreement. And so
Correct. Unless the hospital pulls a 180 compared to the last 7 years, but
Suddenly gets whatever. Yeah, it's a big issue in our community, and
who would it fall on to if you wanted to pursue that administrative hurdle? Like which entity within Whatcom, would ideally be responsible for updating that DSA, having those conversations?
county attorney, public health.
Okay, great. For Gelada, this one I wanted to clarify the scope because I'm not sure quite how many intercepts it would come into play at. But my understanding is it is accessible, could be pulled into the data warehouse.
It is, and it can. It is limited to the population that interacts with the response division.
So limited amount of people.
Hundreds of people versus tens of thousands.
Yeah.
Julia, let me just say that from the standpoint of the intercepts, I think that you could make the case that it has data that would be relevant to I think intercept 3 because of the mental health court use of Gelada, and then as well to reentry and post incarceration community supports as are provided through the GRACE program and the LEAD program.
Yeah, mental health court is not implemented, and technically at some point that would be available. And in terms of reentry and post-incarceration community support, it definitely it's just limited to those programs, and the emphasis of those programs, especially stuff that is in mental health court, isn't necessarily post-incarceration community support. I mean, if they happen to have been incarcerated and interact with those systems, so be it, but it's not the population that they are seeking to engage. Whereas mental health court is really specialized. And so they would be, in terms of like you just knowing how it all kind of keys together, they're gonna know most about intercept 3.
So for intercept 5, there's a subpopulation of the LEAD population that may have been incarcerated, for whom there may be relevant data in Gelada. Would that be accurate, Chairman?
That's accurate, yeah.
Okay, but once again, subpopulation, right? It's a limited amount of people, but yes, it could provide data there. But you're saying that for intercept 3, really, it's going to be data that's coming from mental health court that would paint that picture much more than Gelada. Okay, great. I would like to add a comment, but it giving me the option. I'll just write in here. So then for community-based organization data, that's obviously quite broad. But there's many programs operating at this community services intercept. So this is just kind of trying to capture that there are community-based organizations that are out there probably collecting their own data I would guess not in necessarily standardized ways or ways that are easy to pull into a data warehouse. Is that correct, or do folks have other thoughts on this one?
They have some of the same constraints as being able to access Epic because of the HIPAA limitations, particularly for those community organizations providing behavioral health services.
And when you say
But I would say that, and so I guess I would put those in the pink category at several of the intercepts. Just because I think as people are involved in the criminal legal system, it's often in conjunction with having been involved already in those community-based services, including housing and other kinds of community supports beyond behavioral health services.
Mhm.
And when you say similar constraints, you're meaning similar constraints that we face around us trying to access Epic.
Right. Because of the HIPAA law and 94-142, which is the substance use disorder restrictions on access to service data.
Do folks have specific community-based organizations that come to mind here that would be helpful to list?
Certainly Compass Health, Lifeline Connections, Lake Whatcom Center, other licensed behavioral health providers.
Mhm. What about Opportunity Council in terms of housing and things like that? And
The-
social service support, that's been an issue at times, getting data from them, and I don't know if it has improved or if it falls under, it's a little different than HIPAA, but they have had similar reluctance, I think, at times.
Right. There are similar constraints. One of the things that I think people have been trying to sort out is the extent to which, for example, under HIPAA or housing privacy laws, the notion of coordinating care and services can be used as an exception to the restrictions on limiting sharing of data. But those are administrative, hurdles that will need to be overcome through both through data sharing agreements, but also through mechanisms by which people receiving services themselves can more efficiently agree to sharing of data. Right now, those are very siloed processes in terms of getting client permission to share their data. But if there were some work to be done on how those kinds of permissions could be integrated together across silos, that would be a way to overcome some of those administrative barriers.
Are there any, so just kind of now, instead of looking specifically by row, but now looking by column, are there any things or data systems or sources at Intercept Zero, so community services, that you feel like are not captured with what we have so far? So in terms of CAD, Whatcom, Fire and EMS, Epic, Gelada, and community-based organization data, any main ones you feel are missing here?
What about out of county services? I don't know how much of an issue that is, but there's been considerable discussion about people in Whatcom County's legal system with warrants from other communities and things that impact them, and that's not quite intercept 0, but it is intercept 1. And I would have to ask somebody involved how much of an issue that is, but I've heard it in discussions.
Caleb can correct me if I'm wrong. There is no central repository for warrants. Each municipality
Right.
tends to have warrants based on their jurisdiction. And so you can go to each of those Whatcom County is not huge. There's only so many municipalities, but if we're talking, external municipalities, there might be a federal system that I'm not aware of. I mean, I know that there are federal warrants, but
Yeah.
again,
I don't
Caleb would
know
know
that
more than me.
there
I
is.
don't know there is like a
Yeah.
central place to get that.
But in terms of recidivism and past records and all of that, that might be an issue unless we define our data searches as only those specific to Whatcom County, which
Is
leaves out a real issue, so.
and again, I'm going to lean on the chief. So this is the largest hold facility in this region, and as such, it kind of acts as a magnet. So there being traffic from folks from other municipalities, other jurisdictions, isn't really operationally all that strange. Because it's just kind of how it works. Since there's people get shipped off to Yakima and whatnot, and might get processed through Whatcom County, but aren't necessarily from Whatcom County or have charges in Whatcom County. Is that an accurate thing to say?
Yeah, and I was thinking as you were talking about, there's not a central repository for the actual individual warrants. Each jurisdiction is responsible for keeping, maintaining their own warrants. However, there is a central repository for law enforcement access only, where you can find out if somebody has a warrant. Otherwise, nobody would ever know. So that does exist, but it's not something I think that it would go into the red box as well. It's not something that they're going to give access to for this purpose.
And I was thinking more of I don't know that this has been decided, but if we limit our project to Whatcom County residents, then it's less people wandering into our community and getting warrants than it is our community residents wandering into other counties and getting warrants. That then impact recidivism and those kinds of issues, I would think, though I would obviously defer to those in the field.
Yeah. Oh, go ahead, Jeremy.
I don't have a ready answer. We've discussed a couple of times as a population, someone having active warrants or previous warrants is not necessarily a crazy strong indicator of like how that population moves around. People are really, really mobile. I mean, I remember even working inside of public health or for EMS, people were attempting to out of state send people to when base camp was up and running because they're looking for beds kind of thing. And these populations move around a lot, and I'm not sure whether or not someone catches warrants in or outside of Whatcom County makes a tremendous amount of. I'm not sure. I don't have enough information to say if that would make a statistical difference or not.
Right.
And that kind of ties to one of the next steps that I wanted to chat about later, which is around, right, how do we define certain things? So I'm gonna table that for our kind of high-level next steps conversation, if that's all right with folks, just from a timing standpoint. So kind of moving on to then more Intercept 1, we have access to Bellingham Police Long Arm, as well as Spillman RMS, so Records Management System. Do folks agree with those? And do we feel like either of these pertains to other intercepts, or really just these are law enforcement?
I've been kind of looking at all the other intercepts as we go here. I don't think that there's data in Spillman that really crosses over into other intercepts. It's certainly not more than a repository for information. It certainly isn't the generator or the initiation of that information. So it's probably best found elsewhere.
Then moving to Health Secure, the electronic medical records, I wasn't sure, is this something, one, is it just kind of within Intercept 2 and 3, so within that initial detention and court hearings and jails and courts, or is it across all of the intercepts? And then also, is it accessible and could be pulled into the WCHCS?
We're going to run into similar issues with Epic, where there's a lot of very specific HIPAA protected information in a health records system. Technically, we have more access to Health Secure than some of these other formats because it is jail data. However, we would have to potentially still have to meet the same hoops and same requirements to be very careful of how we share and use that information. There was two parts to that question, and I got lost on both of them as I was talking.
So you answered the access piece, and then in regards to kind of the intercepts, does Health Secure really just operate, within the jail space, or is it kind of across other intercepts as well?
I don't want to speak for everybody on the team because, for example, I know that Lifeline uses Health Secure, but they may also or may only enter Intercept 4 information in their own software rather than in Health Secure. So I'm not entirely certain what data gets entered into Health Secure from a reentry and post-incarceration support. It's certainly worth asking, but I don't know off the top of my head.
Okay. And in terms of like who would be responsible for if you wanted to kind of work through some of the HIPAA things, data sharing agreements for Health Secure, would that fall to you, Caleb, or is that a different person?
Yeah. I think just it's easiest to say me.
So let me
yeah,
just suggest that some of the, given that Lifeline is also doing the reentry work, and at least the last I heard, unless something's changed, then that would suggest that up there in the community-based organization data row, the reentry column ought to be included, at least as it relates to Lifeline. But again, it should be a pink, yeah.
Yeah. Great. Good flag there. Now we're going to get into, we have a lot of greens up here, which looks nice. Some reds, pinks. Now we're going to get into, I think, less fun. But one more that is green. The jail management system, so Spillman, again, my understanding is we have access to that, can pull it into a data warehouse, and I have it covering Intercept 2, 3, and 4, but curious, Caleb and or others, if that sounds correct to you.
I'm not absolutely convinced that we're going to get meaningful data for Intercept 4 out of Spillman.
Okay.
The stuff I've seen over the course of years is a chain of custody thing. So as people move, like, EMS, they have their chunk, and then, the jail has their chunk. And then once, that code is, they've left the facility, you can kind of make connections potentially, but it's handed off to the next particular system. It's again, nothing's broken. It's not a bug. It's just a feature.
Okay. I'll leave this. I'll put it to gray for now. Then we get into the courts. So there's a lot of, from what I was able to piece together, data systems that fall, across a variety of different levels of courts and whatnot. And from my understanding, we do not have access to any of them.
The CCM is being used with mental health court as a stopgap. It's used for like drug court or something like that. And so it's used as a primary way to communicate between different parties inside of the justice system. It is not a great resource because it's not designed to export anything. The court CMS and Odyssey Superior Court, that's all the information that gets sent to the state at the Administrative Office of Courts, the AOC. Another project that the information exists and the technology exists to get to it, but there need to be an administrative project at the county level involving the county attorney and some signatures from the executive stepping in and saying, hey, we need to get access to X, Y, and Z because it is all of our own data. But, and I've said this before, administratively, these systems are not designed to interact or report out. And there isn't a lot of administrative or case law examples of this kind of work being done. Hence, when we interact with departments, their reaction is sometimes surprised and generally a little disoriented because what we're doing is really unusual from their perspective.
So let me make sure I captured that correctly. You flagged DCCM as it's operating as a stopgap and is not actually meant to export any data. So
stopgap for mental health court. That's why I know anything about it. I'm sure whoever uses it regularly doesn't have a problem with it.
Okay. So you would agree though that like red, pink, whatever color we want to call this, for both of those.
Yeah, we've had conversations with Odyssey and CMS. There are interfaces. They don't go to us. The information isn't kept locally. There's also a whole conversation where I don't have a bunch of great information on of what is digital and what is printed because the court does love its paper.
Sorry, just writing that down. And then I do have, juvenile court CMS in here as well. Assuming that is all not accessible. I know most of, within the Justice Project, we're not really focused on juvenile court, but it came up in some documentation that I was looking at, so included it here. Any comments on that piece before we look at public defender and prosecutor? Okay. Public defender and prosecutor. So for public defender, I have the Justice Works defender data. And then for prosecutor, it's prosecutor by carpool, if I'm saying that correctly. My impression is these are not accessible to us. And if that is correct, I'm curious, what would it take to get those to be accessible? Who would need to be, at that kind of decision-making table?
And that can correct me if I'm wrong. I think Richie, unless he's changed positions, is going to be the person who knows most about the DA's office. And I forget the name of the current public defender. I know that
Stark Follis is the public defender.
Oh, okay.
Yeah, I would double check for Richie. They have changed their rotation or their scope of who does what. And so like, for example, we used to work with Chris Quinn and now we have someone different. So I think they rotated who they do, but he might still be the through line. I don't know, Caleb, do you have a different, or Dean?
We do not, but yeah, it's still probably going to be a Eric Ritchie decision.
Okay, that makes sense, even if he's not the front line.
Yep.
And
hey, this is Ryan Anderson from the Bellingham Prosecutor's Office. So we're moving to PBK, the prosecutor by carpel, this summer as well. So it's a case management system. Like you're not going to get access because that's the individual prosecutor's case. but you know, their notes and everything they're doing with the case. So no one besides the outside the prosecutor's office is going to get access to that. But the nice thing about the system, and we are obviously haven't implemented it yet, but we're going through testing and build up, and Eric's office will operate the same. We are able to, depending on the data that we put in for individual cases, you actually can run reports that will produce information for you. And that's probably where that system will actually be helpful. And I would imagine, hopefully, Eric's office would be like ours, where we would be able to access that and run a report that would give you data based on, you know, how many people that this month were charged with this crime or reported, you know, were unhoused or, you know, stuff like that. Or people have, you know, where there's certain data points that we'll be putting in for each case. So you won't have access to the case itself. But again, we could, the system does allow you to run essentially reports based on certain fields, and you can pull that out of that. So that should hopefully be helpful, even if you don't have access to the actual system itself, that reports could be run.
So Ryan, I have a question. Is there any possibility for having discussions about selected information being shared that is case level, simply having to do with, you know, who is an active case, to what extent are they, I mean, just information demographically, not just
Yeah.
demographically.
Oh, for sure. Yeah. So that's what I was saying. So for instance, really brief here, but like when we we get a case, somebody gets arrested for a DUI over the weekend, right? We're going to come in the morning and put in, you know, Jim Smith, and then build out a case with all sorts of information. We can put in as much information off of that as we want. We can put in race, ethnicity, housing situation. We can add all of that, put all of that in, right? And then but then that gets built into that, pops in a case, then we put in police reports, criminal histories, we start putting all of our notes, witness notes, you know, everything. So that becomes our file. But what we can do is, depending on what data we put in on each of those cases, hundreds of times a week, right, thousands of times a year, you can pull that. So if you said how many of the people pick whatever statistic or whatever category, right, like how many people were identified as African American, right, we could run a report and tell you how many. That's just as an example, right? Or like I said, unhoused. You know, it just depends on what data you put in as the prosecutor and what your office staff is going to put in. But yes, you could absolutely run a report that would tell you all of those things. I don't know yet, honestly, because I haven't used it for that purpose yet, because our go live date is in July. I don't know if it would tell you like names in cases, like if it would give you a report and said, you know, Jim Smith, you know, Jane Smith, like if it would give you all those names and that. But I know it will be able to run reports. The idea is that it will be able to run reports that give you, you know, good data on what you're doing and what you're seeing from a prosecutor standpoint. So
Okay, but I think I am asking about, you know, identifiable information about individuals
yeah,
involved.
that I don't know. I can't answer whether it would do that or not. I just don't know. I've not experienced that portion of the system yet. So
So I'm wondering, just as a general thought, you know, when we're talking about how to overcome these various administrative constraints, the extent to which the administrative office of the courts, through their various initiatives, might be a resource in helping us work through these administrative barriers to begin working on ways to share information that won't compromise, you know, the integrity of a case for both the public defender and the prosecutor's standpoint, but still allows us to know that when a person who has a history of mental illness or substance use disorder enters the system, that we are made aware of that in such a way that we can work on diversion or alternatives to incarceration. And so because I know the Administrative Office of the Courts has initiatives going on. I believe they've worked on similar projects in Pierce County, and I think we'd like to keep that as a note, you know, for future consideration.
Great, that's helpful. And just one follow-up question on that, you know, in regards to kind of connecting with the AOC, or right, like sitting down and having conversations with the prosecutor's office or public defender, like who would be interfacing with them? Is it public health? Is it others?
County attorney.
County attorney. And who would be asking the county attorney to do that?
Right. I think that is one of the unfinished questions, getting to where we're headed. Once we get some element of plan in place, at least to me, it's not clear who the entities are that are going to take the plan and champion it forward. And I think that's something that our community is going to have to have an answer to in the next month or two. And whether it's subcommittees of IPRTF, whether it's exec, whether it's a combination, is quite unclear, but I do think that's a question that has to get answered.
I just wanted to say I've got to run, so I
Oh, okay.
apologize. I have to duck out, but
Yes, well,
it's,
thank you for being here, Caleb. And let me ask you a quick question before you go. I
course.
think there's going to be more work for this committee over the summer. Will you be available at the August meeting? I don't want to have a meeting in August if everybody's out of town except one or two of us. It's early in August, and if you don't know at this minute, you could just shoot me an email, or shoot Jill an email. I wanted to get a sense.
What's the date? Is it
I think
the
it's the 4th. Jill, are you on the call still?
7th?
That could be
Sorry,
It
I had to
appears-
step away for a second. What's the question?
the date of the index committee.
The next index committee
Yeah,
would be August 7.
okay.
Yeah, it looks like I'm available at this point, so.
Good, thank you.
All right, thanks, everybody.
Okay, thank you.
I'm looking at the clock, and so really quickly, does anyone have any comments in regards to therapeutic court tracking system? Sounds like DCCM is operating as stopgap for drug court, which I think is what you said. And then I also have Tyler Caseload Pro, and then not a lot of visibility. Really think it's just like tribal data systems, which to me is a big kind of gap. I don't know what conversations have or have not happened with tribes on data, what data systems exist, what data sharing would look like. But any comments on these last three? Okay. Okay. Well, we have 7 minutes left. Is that correct?
I know.
So Bertie, do you want me to share regarding the change to?
Yes, I do. That would be very helpful because I think that will inform us, and I don't know that we can make a decision today. At the same time, one of the roles of our committee is to decide what our work is for the next few months, and that is highly dependent on how you are involved.
So the change to kind of the scope is specifically around the data dashboards. As I've talked with more and more people around data and whatnot, as well as, I met with Jeremy and Lynette on Monday, and we were talking about it. And right, you can see from that table I just showed you how much is not accessible.
Right.
And on top of that, there's some key decisions that need to be made on how to actually define some of the things we want to measure, right? And so very simply put, we can't track if we can't define something, we can't track it, and we can't measure something that we don't track. So that's the stage that we're at. So, we discussed that it feels very premature to focus efforts on building out mock-up dashboards and communications plans when the immediate next steps have nothing to do with that. And so what the change is that, the hours that I would have spent working on that, on creating mock-ups and whatnot, will be redirected towards, building out more thorough, recommendations around data systems, next steps, and things of that nature. Yes.
And so that will all be in these last 4 weeks, or is there going to be any extension of your time?
That's a great question. That has not been discussed.
Okay.
Yeah, so,
Yeah, but
Yeah.
so at the very least, at the end of June, we will have all that you can do to have recommendations about how we define data, and then it will fall to some entity or more than one entity to make decisions around that. Correct?
like how to move that forward. Yeah, I don't know
Yeah.
if Dean or Lynette or anyone has any comments there. You know, I will put in recommendations about what I think needs to be done, but I do think that there
Right.
is some question mark around who, right? And I can try and
Absolutely.
indicate that, and you all can
Absolutely.
give feedback,
And
but
obviously, the county exec's office will have to weigh in heavily on this. So,
Mhm.
Lynette, do you have any comments?
I don't think so. I already, we had talked about this at our meeting, thinking about the program metric data and then also in the future, the population data. And just, I agree with Julie. I just don't think we're there yet to be making, even getting the idea in people's heads about what our dashboards could or couldn't be.
Right?
Because I don't want anyone to be like, oh, this is what we're gonna have, just like Vermont. And then we can't deliver that. So
Yeah.
we're getting a little ahead of ourselves. So I think really focusing on the data systems, how we would actually need this to work together, is a much better use of our experts' time.
Mm-hmm. Sounds good. And one of the things I acknowledge that I'm a bit on the outside looking in because I'm not actually working in any of the IT departments. But it seems to me that we don't have clear consensus on certain fundamentals about how we define data entry points. And until we have either a bigger guru, a external chief that says you will do it this way, we are going to have to find some mechanism for making sure that all the intercepts and all the various data systems are defining things in the same way.
Yeah.
Okay.
That is one of the
Yeah,
fundamental.
the elephant in the room, so, okay.
All define, mental illness the same if we really want to track that. We don't all
Absolutely.
define race and ethnicity the same if we want to track
Mhm.
that. We don't actually have an agreed upon definition of recidivism. We have what we could define it as based on what Caleb's jail management system could tell us, but
Right.
it's actually how you want to define it, right? So,
Right.
and those are, we've started those conversations, but
Mhm.
beyond my scope to truly land on what that definition is and figuring out who is responsible, who is the person that makes the executive decision to say, yep, this is how we're defining it, and this is gonna, trickle down then.
Yeah. Okay. Well, that's very helpful. And so we have 2 minutes left. I want to allow for public comment. I will just real quickly say that we will plan to have a meeting in August, and I hope as many of you as possible can attend our August meeting, and maybe we'll have more defined answers at that. At the August meeting, we really need to look at the IPRTF action plan, and it is written about the index committee and what we will do. I think we're going to need some serious discussion and engagement of those of us on the committee to determine what's reality and what is going to be done by us. So stay tuned. And thank you, Julia, for all your work. Any other comments before we turn it over to public comment? Okay. Jill, is there anyone attending in the public realm that would like to make comments?
We do have a number of attendees, one with a hand raised. If anyone else would like to speak to the committee, please virtually raise your hand now. Marty, go ahead.
I was just sitting in today. Thanks for letting me do that. And I made this comment in writing to Julia, but I just keep thinking about whether there is anything we can give the public now about that looks like a data dashboard that we have that would be interesting to them, so that we have something. And the things that come to my mind are booking data with qualifications noted on it, like when were restrictions in place, when were they lifted, average daily population in the jail, and average length of stay in the jail. Like, I think those are some metrics that are interesting to folks. They're certainly interesting to me, and I know they've been kept a long time, and they are related to outcomes that are defined in this plan. And I just wonder if it might be worth trying to get a nice little graphic up online on the Justice Project website. And maybe this is a question for the executive's office and Caleb, but get a few of these, a few graphics online and just keep them updated quarterly. So there's something there that looks like relevant, interesting dashboard-like material.
Thank you, Marty. Is there anyone else in attendance who would like to speak to the committee? And I don't see any hands raised, and I don't see anyone in our conference room. Bertie, if you have a minute to chat after the meeting, that would be great. Thank you.
Yes, sounds good. Thank you, Marty. And I think your point is an important one, and we'll probably have further discussion in other forums. Okay, so I will declare this meeting adjourned, and then I will stay on. Jill.